COVID-19 hits the United States. Now, we knew it was coming. We knew it was in China. We knew China was building multiple hospitals, and yet we were flat-footed and entirely unprepared with a president and a federal government that basically left the country in the lurch. Yes, they eventually did the PPP loans and they gave the $1,200, but again, the CARES Act was a huge swell of income to the top. And many of the PPP loans basically went to people of means, leaving many of the small businesses to die on the field or to die on the down the side of the road by themselves, left to their own devices. And so this was kind of our experience in the United States in regards to COVID-19. From a medical standpoint, though, I want to get there for a moment. So right now, Andrew Cuomo is walking around with a magnificently unfounded sense of confidence over what is an abject failure in New York. Now, understand for the moment, in packed conditions, the pandemic gets worse, right? You have the easier ability for transmission, especially a highly transmissible virus. And if people aren't wearing masks or if people are congregating, whatnot, well, it's going to spread, and it's going to spread relatively fast, and it's going to do so in somewhat of an exponential way because each individual that becomes a carrier is going to contact multiple individuals who are also going to contact multiple individuals, and so on. 40,000 deaths, New York. Cuomo was slow on the uptick in regards to putting in methods in order to try to clamp down in regards to the economy. And on top of that point, on March 25th, he passed a mandate, or called for a mandate. Now, within the context of that mandate, Cuomo basically said patients can go to nursing homes as long as they're stable. I said that wrong. Patients who are either expected or patients who are suspected of having COVID-19, as long as they were medically stable, were allowed to go to nursing homes. I repeat, March 25th, he gave a nursing home mandate directing nursing homes in the state to accept patients who had COVID-19 or were suspected of having COVID-19. Now, this is somewhat dicey when your country is being ravaged by a virus because you're going to take them out of this compacted space and put them into a further compacted space within the walls of a nursing home. And you are basically saying, look, these people might have had it before, they might have it now, but we're not necessarily going to test. To make this worse, as if, like the guy who just stabbed somebody, not able to look at the dead body, looking back at him, he throws a sheet over him. Cuomo went further and basically said nursing homes were prohibited from requiring medically stable prospective patients to be tested before the virus, before they arrived. It was prohibited, meaning they were disallowed from even checking to see whether or not the people who they were bringing into that more confined space had COVID-19. They were disallowed. That's astonishing. Now, on top of being disallowed, Cuomo, as if you couldn't necessarily go further, then passes a provision that allows immunity to nursing home executives. Of course, donations, coincidental. Of course, they're absolutely and entirely coincidental. What happened with this scenario, right? This is a recipe for disaster, and it was a disaster. On record, they had, 6,000 people that they were owning up to? So right here, between March 25th and May 8th, approximately 6,325 COVID-positive patients were admitted to nursing homes, according to the state's health department report. The state's official care home death toll is just over 6,500. And when did this one come out? This one came out September 30th, so the number is going to be a little bit higher. But Cuomo has basically taken actions to try to mitigate some of the previous behavior. But the previous behavior, we should understand, was utterly egregious. And giving Cuomo this kind of pat on the back, good job, When that state has 40,000 deaths, that is utterly appalling. And there's more information to the story, which is why I'm talking about this right now. When Cuomo was asked about this, hey, how do you reconcile the damage that was caused based on your actions? Listen to Cuomo.
I put my head on the pillow at night saying I saved lives. That's how I sleep at night.
That's how I sleep at night. I lay my head on the pillow at night saying that I saved lives. Now, with the actions that Cuomo take, as it goes further, potentially saves lives. Yes, by definition, putting in a mask mandate or having social distancing or closing down restaurants. Yes, those things ideally, would save lives, especially in the context of a pandemic. But the idea that you save lives, you sent all of these people basically to a death chamber in the name of a nursing home. They had no escape. They were packed in there, and not just packed in there. What about the staff that's also in those buildings? Not allowing them to test and not allowing them to basically make sure that that individual doesn't have it. Where do they put those people? Where do they put them? Are they put them in general population? And whether they're in general population or not, what about the staff? I hope you get what I'm getting at here. This was a disastrous choice. This was outright incompetence. Meaning, yes, there was a virus, and then there was incompetence on top of the virus that basically upped the number of people that died. To give you a taste of how significant this is, right here, 42% of U.S. deaths are from 0.6% of the population. Well, what do you mean, Jamarl? 42% of COVID deaths, 0.6% of the population. It's because they were from nursing homes. 42% are basically people either in nursing homes or affiliated with nursing homes that basically dropped dead as a result of COVID-19. That number is startling. Now, I don't know if that number is still 42%, but that number is startling. This story, by the way, gets worse. How could it get worse? How could it get worse than Andrew Cuomo sticking people into, out of incompetence, into healthcare facilities that are basically compacted centers that are even more compacted without allowing the ability to test, without checking to make sure the people who are brought in are safe that don't necessarily have COVID? Yeah. How could it get worse than that? Well, and even after giving those companies a pass, meaning giving those executives of that company basically immunity from prosecution, with stats like this, 42% of the deaths from 0.6% of the population, would there be prosecutions if there was anything that wasn't done to ensure that those residents remain safe, especially from the point of view of the information that you knew at the time? The answer, of course, is yes. We're a litigious society. Cuomo gave those guys basically a benefit by giving them immunity. And again, coincidental that they just so happen to be donations. But yeah, it gets worse. So these places, nursing homes, are strapped for cash. Now, part of the reason they're strapped for cash is because they had to put in new measures, new procedures. They had to bring in additional staff in some cases. And on top of the procedures, the staff, the infrastructure that they had to add to ensure that the patients are safe. And in addition to that stuff, you also had a situation where some of the most lucrative patients dried up. Now, nursing homes act almost like hotels in an odd way. I didn't know this, but apparently this is true. And so when people have surgery, my grandmother, I think even my mom at one point, they would let them go there for their recovery. Now, these are somewhat lucrative contracts, right? So these are ones where they're allowed to help make up and bolster their bottom line. Well, those dried up. The elective surgeries and those type of things basically went out the window at that point. And when the elective surgeries went out the window, well, some of their business model also went out the window at a time where basically they were being full. There's a shortfall on the nursing homes when many of these guys are thinking they're only going to be there in existence for a year. I think they said 90%. They're calling for a bailout. And, So the 90% is basically, that could be a certain degree of propaganda where they're trying to get more money from the federal government, just like many of the other industries are trying to get more money from the federal government. One of the things that was happening, though, and the reason why I'm mentioning this, is because the COVID patients were rather lucrative. When it got to the point where they would send COVID patients to these nursing homes, what the nursing homes started to do was to basically drop off its patients, the people who were there prior to the COVID-19 patients and the money that the government was giving for the COVID-19 patients, and they would drop them off. There were reports in the New York Times talking about patients wandering the streets in the cold, not necessarily knowing where they are, delirious, full of dementia. And they did this because it was lucrative for them to do it. In the same way these guys are talking about they need a bailout and everything else, they basically went in the direction of cash, and just so happened that direction of cash, where COVID patients, especially as hospitals started to fill up and the nursing homes opened their arms, come on in, and they can shove out the patients through the back door as they did it. It's utterly grotesque that they would do that. Many of these patients, some of which, of course, wouldn't be able to pay. You have a lot of people who are in poverty that might still need long-term care. In fact, most of us are probably going to need long-term care. And yet, that's the thing that we don't necessarily focus all that much on in our society. And this is a baby boomer generation. And yet, that is not something we tend to focus on in our society. And look, whether that number is 90% of nursing homes are going to go belly up, a lot of nursing homes in many states have already gone belly up for the exact reason that I was telling you about the costs and the inability to balance the costs and so forth. What happens when our boomer generation comes of age, and whatever percentage that is of that boomer generation that requires long-term care, and those nursing homes aren't available? Now, my grandmother, when she got ill, we would never be able to afford a nursing home in the first place. And I don't think we would have ever put her there in the first place. My mom basically broke her back to take care of her. My mom has this idea in her head that is a noble one, even though it's not necessarily entirely true, just for flat fact. Reality doesn't all that much care about ideology reasons. That even though she may not necessarily have the funds to do something, I can't pay for another nurse. I can't pay for this particular thing. If I exhaust myself, if I give everything that I have to the point of exhaustion, that will balance the scales. Meaning, at that point, I could say, I've done everything that I could do. Now, that is not entirely productive, but it's understandable why somebody would come to that particular consensus. Even when you have other brothers and sisters, not everybody is acclimated to taking care of another adult. And if you are, dealing with jobs over the course of your life that didn't necessarily pay all that well, how are you going to pay for somebody like that? I mean, ultimately, you're in a situation where you yourself also have to work while trying to take care of this particular parent. And I'm saying this from personal experience. Whereas my uncles, my mom, they're in their 60s. They have to work. My mom doesn't have to work, but my uncle has to work. And they were still in a situation where they still had to dedicate time to taking care of my grandmother. Now, like I said before, I don't think that situation is abnormal at all. And the issues that we were having with the government about you need $500 a month in order to get somebody to come there over the course of the day, etc. And it's like, you realize most people in this country don't have $500 in their bank account. And let alone having $500 in their bank account would be able to just blow it month after month after month in this way. Not to mention, if we had that much, we probably could get a nurse ourselves. These aren't things that are necessarily negotiated. These are things that families have to end up dealing with on their own and don't realize it until they have to end up dealing with it. I'm saying that the long-term care, even from the standpoint of the Medicare for All Act that expands the issue of long-term care and put that front and center with the other issues of life, it would be a big deal. It is vitally necessary. And I guess my feeling is if that's not something that we're going to get done, we are going to be at the bad end of that when we get to the end of our own and these facilities, or for that matter, nursing or staff or whatever, that families can get based on long-term care from the standpoint of the government. Those things may go the way of the dinosaurs, making life that much worse. All I'm saying is that Cuomo should not get a pat on the back for this. The new wrinkle in this is that as bad as the deaths for this were, meaning however bad the deaths that was expected, Cuomo is being accused of having twice as many deaths from nursing homes. Now, why twice as many? I'll go to the article. So this is the New York Times. The New York State Attorney General accused the Cuomo administration of undercounting coronavirus-related deaths at nursing homes by as much as 50%, according to a report released on Thursday. The count of deaths in the state nursing homes has been a source of controversy for Governor Cuomo and state health department officials who have been sensitive to any suggestion that they played any role in the number of nursing home deaths, which put it at the state at 8,500. So the thing is, Cuomo and his team wasn't necessarily counting people who died later. So they were like, they had to die immediately in the nursing home. But the deaths that were, let's say, around the nursing home from things that took place, they were basically leaving these off. They have been accused of obscuring a more accurate estimate of nursing home deaths because the state only counted deaths at actual facilities rather than including deaths of residents who were transferred to a hospital and died there. It's like, well, that guy might have went into respiratory distress here, but we got him out of here, and so he doesn't count. He doesn't count. And so the 76-page report released by the Attorney General, Letitia James, Lolita James, I'm sorry. Yeah, looking at that, says the T and the L, they look so similar from this distance. Letitia James, a survey of the nursing homes found consistent discrepancies between deaths reported to the Attorney General's investigators and those released officially by the health department. Meaning, however bad it was, this just gets progressively worse. And like I said, it culminates into, we're talking about thousands, tens of thousands of people who basically died at the nursing homes at this point, if the numbers match up and are accurate. For obvious reasons, they will want that number to seem less. They don't necessarily want to be hit with that particular number. Cuomo will want to be seen as a success for this particular issue. But the idea that you lay your head on your pillow and you sleep soundly, talking about you save lives. At some point, I don't doubt that you save some level of lives, but let's just be very clear. You are absolutely culpable in many of these deaths with incompetence. I mean, I get that the disease was new, right? And it was a pandemic. But the idea that you would tell them don't test is astonishing. Basically, you didn't want to know the answer to whether or not those people had COVID. Meaning you were sending people in that you knew as a flat fact was most likely, just on probability alone, would have COVID, and didn't have those people give them the ability to test. Yes, you're culpable, to put it mildly. And yet, he struts around with, again, undeserved sense of pride in himself on this particular issue as if he nailed it. Put it this way. I don't think there's any situation where 40,000 lives in one state is a success. I don't buy that at all. And regardless of how many times they try to throw that in your face to make it look like a success, trust me, it is not. I don't doubt that New York would have had some level of death. Of course. What I'm making the point is that is the level of death in New York emboldened by or lessened by putting people into that much more of a confined space and then not even giving the staff the means by which to ensure that those people don't have COVID? At this point, I mean, it's questionable whether they even had the resources or anything else to be able to even prepare for that. But to even let them go in there blind like that, where's the concern for the staff? How much of that staff died? The 42% that I gave you was also staff members that were part of those organizations, either doctors or nurses or people who were also working there, like janitorial staff. Where was the concern for those people? It wasn't even just the elderly. It was also the people who were around the elderly, who was providing care, providing service, and basically who didn't get a break at any point in this COVID crisis. I mean, the nurses at the clinic here, they never got a break. They never got the ability to stop. They never got the ability to rest. Everybody else was either working from home. You might have had some people working at the stores, but they had to come out each and every day, put on their uniform, put on their mask, and risk their lives for us. 42,000 is not a success. Like, share, and subscribe.